Over the last 5 or 10 years, there have been a number of important clinical trials in idiopathic pulmonary fibrosis, and we now know that two drugs, pirfenidone or Esbriet and nintedanib or Ofev, have benefit in idiopathic pulmonary fibrosis. When we see patients in clinic with IPF, we tend to measure their breathing tests or spirometry, and particularly look at forced vital capacity or FVC. This is a measure of the total amount of air that a patient can blow out. We know that, on average, the FVC of patients with idiopathic pulmonary fibrosis declines over time. And we know that both pirfenidone and nintedanib slow this rate of drop by about half. Fortunately, the number of patients who died on the drug studies, both in the active arm and in the placebo arm, was quite small. And although in both studies fewer people died taking the drug than taking the dummy tablet, because of the size of the sample, it wasn't possible to be sure this couldn't have been just related to chance. In the UK, Europe and North America, as well as much of the rest of the world, they are now licensed for the treatment of idiopathic pulmonary fibrosis. In England, their use is regulated by the technology appraisals by the National Institute of Clinical and Health Excellence, NICE. In England, we are allowed to prescribe when there is well characterised idiopathic pulmonary fibrosis and the forced vital capacity or FVC is between 50 and 80% predicted. We're also obliged to stop the drugs if the patient's forced vital capacity drops by 10% over a year.